Dr. Shaibal Guha from Patna. My talk is on diabetes mellitus and immunity. Are they interlinked? So I would be mainly talking about how diabetes affects the immune system. Both it affects the cellular immunity as well as the humoral immunity, and it has been seen that in diabetes there is increase of inflammatory markers due to hyperglycemia, and these inflammatory markers are responsible for increasing all the complications of diabetes, both microvascular as well as macrovascular. And it has also been seen that the same mechanism is applicable in cases of atherosclerosis as well as in obesity, wherein also these inflammatory markers are raised in the bloodstream, and that has led to the concept of common soil hypothesis. And we have seen conversely how anti-inflammatory agents which are used in treatment like aspirin and other agents and statins help in reducing this inflammation and reduce the level of this inflammatory markers in the blood, and how that also helps in preventing or reducing the progression of diabetic complications in future. So there is a clear-cut interlink between the inflammatory system and diabetes, and possibly diabetes being a multi-system disease, probably this link up of the inflammatory markers, the flare of the inflammatory markers, has something to do with the causation of the complications in diabetes as well as the complications of atherosclerosis and obesity. Thank you.